already performed the proper hand washing and proper hand sanitizing. I already provide the patient's privacy. So, hi, I'm Alaine Taroy. May I know your name? So, hi Jamaline. I'm a student nurse from Retdem Fatima Antipala campus, and today I will be assessing your head and neck. Is that okay with you? Okay, so first I'm gonna inspect the head. We're looking at the skin, and the skin color is nice and pink, and we're also going to make sure that the head is the same size as how it should be to the body. And now we're looking for any abnormal movements or twitching of the face that you can control or it's involuntarily. So I don't see anything. Also, the face is symmetrical. There is no drooping on the other side. So we're also looking at the eyes and the ears, and they're on the same level. And while we're here, we're gonna go ahead and look at the facial expressions and test the cranial nerve number 7, which is the facial nerve. So can you close your eyes for me tightly? Can you open it up? Can you smile for me? Frown? Can you pop out your cheeks? Okay, and she do that with ease so that the cranial nerve is intact. So next, we're gonna do is we're gonna palpate her head and the cranium, and we're gonna check for any masses, infestation, lice, and alopecia. So I will now proceed. Can I touch your hair? Okay, so I didn't feel any masses, and also there is no alopecia. The hair is also shiny and healthy. So, um, now I'm gonna perform a proper hand hygiene. So now, the cranial nerve 5, the trigeminal nerve. So, can you clench your teeth for me? Clench, like bite down. Okay? So, clench mo lang muna. Okay. So, can you smile? Okay. Open your mouth. And I'm feeling for any grating or clicking sensation, and I feel none. Okay na. So, now I'm gonna palpate on the sinuses, and I'm gonna put some pressure on the sinuses and tell me if you feel anything. Okay. Sabihin mo sakit ko, masakit. May nararamdaman ka. May nararamdaman ka. Wala kang nararamdaman? So, dito. Okay. She's feeling it. Yup. Okay. So, isa pa. Dito. Nararamdaman ka. Dito. So, next, in the eyes, we're going to inspect the eyes first. The eyelid, the sclera, the iris, and the pupil. So, this... Okay, so the sclera is white and shiny and shouldn't be yellow like jaundice, and the conjunctiva should be nice and pink, shouldn't be red and no drainage. And they set just perfectly fine in the eye socket, no strabismus or anscoria. These eyes were normal. So now we're going to assess the cranial nerve number 3, the oculomotor, and the cranial nerve number 4, which is trochlear, and the cranial nerve number 6, which is obtrusive. So first, I'm gonna be looking for involuntary shaking in the eye called nystagmus. And we're gonna take our pen light and hold it from 12 to 14 inches away to the patient's nose. So now, can you keep your head still and don't move? Don't move your head and just use your eyes to watch where I move the pen light. So, okay. Okay, so next we're gonna see how reactive the pupils are. And to do that, we're gonna dim the light a little bit, and I'm gonna have my patient stare at the distant object, and that helps to dilate those pupils. The normal size of the pupils is 3 to 5 millimeters. Okay, so okay. Stare ka sa malayo. Constrict. Constrict. Okay, so next for accommodation, and to do that, we also need to turn the lights back on. Sorry, I didn't turn off the lights. Sorry, I didn't dim the lights. So now I'm gonna take my pen light again and have her stare at it and slowly turn it inward to the nose. And what we're looking for in that is the pupils constrict and they accommodate eyes across while looking at the pen light. So here we go. So stare at the distance, please, and I don't want you to move your head or anything. Just keep it still and just follow the pen light, okay? So start. Okay, so now I just check all the things with the eyes. Pupils are equal and round, reactive to the light and accommodating, and that's where the acronym PERLA comes into play. So next, we're gonna move on to the ears. So I'll be inspecting the ears. They look outside of the ear. Is there any abnormalities, any redness? Okay. So drainage. Okay, so do you have any pain in your ear? None. Okay, so I'm gonna palpate the ear. Tell me if you have tenderness when I do this. If you feel tenderness whenever I do this. Okay, so no abnormal masses and lesions. So move to the target a little bit. Do you feel any tenderness or pain? Okay. So does that hurt? Okay, so no pain and no tenderness. So now I'm gonna palpate the mastoid process. This. No redness and not swollen. Does it hurt when I do like this? Okay, no. So now I'm gonna test the cranial nerve 8, the vestibulocochlear nerve. So what I'm gonna do here is I'm gonna conclude this one ear and then whisper 2 words to the other side, and then you need to tell me what I've said. Okay, good. I'm good. Okay, good. Okay, so very good. That nerve is intact. So next, I'm gonna move on to the nose, and I'm gonna inspect the nose to make sure it's midline. Okay, I'm gonna inspect the nose and make sure it's midline on the face. And look at the septum. It's deviated. Okay. So, do you have any trouble with your nose? Okay. So, is there any drainage or anything like that? Okay, so can you do like this? Just breathe. And the other side? Okay, so good. Um, airflow, nice and patent. So, now I'm gonna take out my pen light and look inside the nose and look for any drainage, redness, and polyps. So, I don't see anything. So, now, I'm gonna have you smell something and then tell me what is it. Can you close your eyes? Okay, correct. So, that cranial nerve is intact. So, next I'm gonna move on to the mouth. Okay, wait lang. I'm just gonna wear gloves. Okay, so I'm just gonna wear gloves and a mask. And I'll be needing a shield. I'll be needing a shield. Um, I'm just wearing this so I don't get any mucus on my face or any mucus on my mucous membranes and have me safe from microorganisms that can pass from one to another. So first, I'm gonna inspect your lips. It's nice and pink and it's not chalk. So, okay. Now, let's inspect the inside of the mouth. Now, we're gonna check for the cranial nerve 12, the hypoglossal nerve. So, can you stick out your tongue for me and move it side to side? Okay, you do that with ease. So, now, we're gonna inspect for the inside of the mouth. If there is, and this is the tongue depressor for that. Can you open up your mouth? Okay, nice and pink. Wait. Let me see again. Nice and pink, no lesions and no sores. So now I'm gonna look for, I already did look at the gums, cavities, no broken teeth, no loose teeth, and now for the soft and hard palate, look at the uvula. I already did, nice in the midline. And I'm going to test the cranial nerve 9, the glossopharyngeal nerve. So now I'm gonna do is I'm gonna have you say and I'm gonna test the gag reflex. I'm sort of just gonna poke a little. So okay. Wait lang. Nakabahan ako. Ipopoke ko siya so baka masuka pa. Hindi ka masuka? Okay. So, that's good. So now the cranial nerve 10. So the vagus is intact and you're able to talk to me without hoarseness and you're able to swallow. So I'm just gonna doff the things and I'm gonna perform a hand hide. So there. So now moving on to the neck. Now I'm gonna inspect the neck first. So can you extend your neck up? Okay. So now I'm gonna look at your chia. At the midline, no lesions and no lump. Okay, good. So can you move your head from side to side? Up and down? Okay, and then shrug against my resistance. Sige, ganun, ganun. And she do that with ease. So, that cranial, yep, she did that with ease. So, that nerve is intact. So, now I'm gonna place him at a 45-degree angle and have him look at the side. And now I'm gonna look for any jugular vein or distension. And she do that with ease. So, that cranial, yep, she did that with ease. So, that nerve is intact. So, now I'm gonna place him at a 45-degree angle and have him look at the side. And now I'm gonna look for any jugular vein or distension. And I don't see any. So now I'm gonna palpate the trachea just to confirm it is midline. Okay. So, do you feel any tenderness or lumps? Any tenderness when I go like this? Okay, and I don't feel. So now I'm gonna palpate the lymph nodes, all sides, and as I do this, tell me if you feel any tenderness or any hard lumps. So, yan, galang. So, start at the preocular, and then at the back of the ears, and then go to the occipital bone, and the parotid. Do you feel any tenderness? Okay. So, the parotid, the jugular digastric, the submandibular, the submental, superficial cervical, all the way down to the deep cervical chain. So, any tenderness so far? Okay, so then we're gonna go to the posterior cervical, to the supraclavicular. So, no tenderness? Okay. So, next we're gonna palpate the carotid artery. So, one hand at a time. Nice bounding, 2 plus, and now the other side. And same. So, auscultate the carotid artery via stethoscope. And I'm gonna use the bell of my stethoscope to auscultate. Okay, so nice bounding, 2 plus. So I already auscultate the carotid artery via stethoscope. So I already listened to the bell and I had her breathe, inhale and exhale, and I did not hear any brute sound. So that's good, and that wraps up. Thank you.